Hi, my name is Francie Claire. I'm a health coach, and today I'm going to talk about a condition called PANDAS. Remember, I'm not a doctor or a nutritionist. I am a health coach, so none of this is medical advice. Rather, it's educational material to help parents who think that their child might possibly have PANDAS understand what it is and how they could seek help from the appropriate medical professionals. So today, in part one of this series, we're going to talk about what is it, how it is diagnosed, and why it is controversial. So imagine a scenario where we have an 8-year-old boy named Timmy, and he gets strep throat. A week later, he suddenly exhibits extreme OCD, obsessive compulsive disorder, symptoms, and will barely eat because he's afraid of germs. This is something he's never experienced before. He exhibits uncontrolled fits of aggression, as well as panic attacks, which are very, very severe and scary. He also has tics, which he has not had before. It could be PANDAS. This is a typical presentation that one might see. PANDAS is standing for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal Infections. Quite a mouthful, why it's usually referred to as PANDAS. The presence of OCD and/or tics, particularly multiple complex or unusual tics, is an important sign. Age requirement. The symptoms of this disorder will first become apparent between 3 years of age and puberty. If you're outside of that, an 18, 19-year-old, it's not going to likely be diagnosed as PANDAS. It has an acute onset and an episodic relapsing remitting course. That means in the case of Timmy, in our example, he would have this acute onset, but then he might recover and then seem to be back to normal for a while. And then he would suddenly, if he was exposed to strep again, got another infection, suddenly he could relapse. And there's an association with group A streptococcal infection. Now, this is not exactly medically accurate per se, but this was explained to me once as saying it's sort of like rheumatic fever of your brain. So imagine that instead of the strep going after your heart, as happens in rheumatic fever, it goes after the brain. Now, not necessarily that strep is in the brain, just it's thought that there is a molecular mimicry of the antibodies so that your body gets confused and starts attacking itself and interpreting certain types of brain tissue as an invader. And primarily, this will affect the microglial cells in the brain and the basal ganglia areas. That's a little too far in the weeds, but in case you're curious. And there's an association with neurological abnormalities that show up. Now, PANS is a similar type of disorder that you will see, but it is not associated with strep. So this is a wider category that is observed with other infections, such as from mycoplasma, COVID, Epstein-Barr virus, or Lyme disease. I thought I'd throw it in here because, sometimes you'll see a similar pattern, but it will be not for PANDAS. Rather, it will be from another infection. If we think about two potential roads for Timmy, road one is when PANDAS is missed. So what might that look like? That could look like Timmy's parents being very concerned and seeking help for Timmy. And as a result, him getting committed to a pediatric mental health ward for an assessment. The psychiatrist doesn't consider PANDAS. So instead, Timmy is diagnosed with a barrage of psychiatric conditions, including oppositional defiant disorder, intermittent explosive disorder, generalized anxiety disorder, and obsessive compulsive disorder. As a result, he is placed on several psychiatric medications with some severe side effects, and he starts intensive psychotherapy. Despite these treatments, however, he only gets worse over time, and he throws a chair at another child in his class, causing a severe injury. His parents are forced to withdraw him from school, and eventually they actually need to place him in a group home because they cannot manage his behavior safely at home. That's a very unfortunate trajectory. However, that is one that can often be seen. Now, what might road 2 looks like? Well, that could be if PANDAS is properly diagnosed. So it starts out the same. Timmy's parents seek help, and Timmy gets committed to a pediatric mental health ward. In this case, however, the psychiatrist just had a continuing education seminar where PANDAS was discussed. And so they immediately think, oh, when there's a recent strep infection, their radar goes up and they realize, oh, okay, I need to look into PANDAS here. And when they do, they decide that Timmy has PANDAS. So they place him on an appropriate course of medical treatment that includes antibiotics and some steroids. I won't get too much into the standard of care treatment for PANDAS in this part of the series, but those are some approaches that would be taken, because first you want to make sure that the infection is completely taken care of, and then you address the inflammation process and try to bring down the inflammation. So steroids are often used for that, but there's some other more extreme treatments such as IVIG, intravenous immunoglobulin, that's often considered, among other immunomodulatory treatments. Now, because he's gotten the right treatment for the root cause of his condition here, Timmy improves and his family watches for any signs of new infections or flares going forward. And he's able to continue schooling, participating in normal life activities, with his between flare symptoms going back to his pre-diagnosis baseline. Now, that's a great scenario. Just to note here, PANDAS is not always, perfectly treatable and getting back to your pre-diagnosis baseline. Sometimes there is more permanent type of behavior changes or even damage to the brain that happens. However, if you get diagnosed quickly, the outlook tends to be very positive, and it is entirely possible that in a case like this, that the child would go back to pretty much a normal life. How is PANDAS diagnosed? It is a clinical diagnosis, and what that means is there's no kind of smoking gun definitive biomarker. So you can't just take a blood test and suddenly the doctor says, yes, it's absolutely PANDAS. No, it is something where there's a pattern and the clinician thinks about the history, the symptoms they're seeing, the timeline, and based on that, they will decide, yes, I think it's PANDAS or no. But it is a judgment call, and different providers may have somewhat differing ways that they diagnose. Now, there is a flowchart here. I will not go into the extreme details, but this can be found on the PANDAS Provider Network, PANDAS Physicians Network. And it goes through sort of a flowchart that a clinician can use to diagnose. So if Timmy came into the psych ward, the clinician might say, oh, okay, do they have strep? Are they prepubescent? Do they have these similarly appearing acute symptoms from this comorbid symptom blocks? This includes elevated anxiety, extreme emotional lability, depression, irritability, aggression, all sorts of things. So they say, okay, they have to have strep, they have to be pre-resistant, they have to have at least 2 of these other comorbidities. And going through the flowchart, they decide, okay, yes, is it mild, moderate, or severe, or extreme? Now, again, I'm not trying to tell you to diagnose your child based off this flowchart. I'm just providing this as a source of information that you can go to, and you can also show to your medical provider. How is it diagnosed continued? There are some tests that are run as part of the process. So it is not, like I said, there's no definitive biomarker. However, some tests can be useful, especially say, for example, you never got tested for strep, but you had a sore throat. So let's say, Timmy, say his parents never actually took him to urgent care and gave him antibiotics. They just remember, like when they're being asked questions, they just remember, oh yeah, he had a sore throat 2 weeks ago. Like, I guess it could have been strep. It went away after a day, but it could have. So in that case, the doctor may want to run strep titers, the anti-DNase B, or the anti-streptomycin something, ASO. And those can say, like, not with extreme certainty, but they can give information, like, was a recent strep infection likely or not, and how recent may it have been. That often requires multiple blood draws, like over time. But that can be useful for if there wasn't already a test for strep done at the point of the symptoms coming on. There are also neuroimmune panels. So these test for if you have antibodies in your blood that are going after certain things in your brain. And so the Mayo Clinic has a panel with, I don't know, 17 or something markers that they test. There's also some private companies that offer panels. One is Vibrant Wellness. They have the neural zoomer pattern, which I can't remember how many it tests, but I think a couple dozen. That one, there's some controversy about how reliable it is. So, as always, do your own research. And the Autoimmune Brain Panel was formerly known as the Cunningham Panel, which was designed sort of as an approach to try to see, can we get biomarkers for PANDAS? Now, reminder, it's still a clinical diagnosis. So it's entirely possible for someone to get negative on all of these tests and still get a diagnosis for PANDAS, but they are important as supporting information. And they're also really important for making sure that differential diagnoses are ruled out. So Sydenham's chorea, which is one that is another unusual reaction to strep, that can also cause unpredictable and new movements that could be confused with tics. There's also neuropsychiatric lupus. And of course, wanting to differentiate between your quote unquote typical psychiatric diagnosis, right? So run of the mill OCD, your general anxiety that's not a post infectious reaction to strep, or depression, or maybe the onset of schizophrenia or something like that. So it's important for doctors to try and figure out the right diagnosis, right? They don't want to diagnose someone with the wrong thing. So all of these additional tests can be useful information when they're trying to figure out if PANDAS is what's going on. Why is PANDAS controversial? All right, so you may or may not be aware watching this video that some doctors do not believe that PANDAS is a real diagnosis. They think it's BS, they don't think it could be possible, and they just don't buy it. And the reason for that primarily, I think, is a few. One is that it's a relatively new disorder still that's been aware of. So it was first described back in 1998. That's only, 20 something years ago, not even 3 decades ago. And so it is something that is a relatively new disorder to know, and it's being refined over time. Like I mentioned, PANDAS and PANS. People are wondering, like, well, should we really have PANDAS versus PANS? Like, what are they part of the same thing? Like, how are they different? So all of this stuff is not settled science, right? It's still under exploration. So while it's a very valid condition, a lot of doctors still don't really know about it. When they went to school, maybe they never heard of it, right? If you go to a doctor that's been in practice for 30 years, I mean, they went to school before this was the thing. So depending on what kind of continuing education they do, what journals they read, they may not even have ever heard of it. And it's a clinical diagnosis. So whenever there's a clinical diagnosis, I think there can be reluctance and lack of being sure if it's the right diagnosis. And especially if this is a rarer condition that a doctor maybe has never seen before, they may be reluctant to give a diagnosis based on a clinical pattern. There's a really wide range of estimates for how rare PANDAS is. Some sources say, 1 in 10,000. Other sources say up to 1 in 200 children. So that's like a huge variant too. And so there's a lot of lack of clarity for some clinicians, even if they've heard of it before, to know, like, well, is it really? Because, how common really is it? Medical professionals, I've kind of been talking about that point. Comorbidities can cause a lack of clarity as well. So in the case, for example, of a child that already has anxiety, if they suddenly have extreme panic attacks, do they have PANDAS, or is their anxiety disorder just getting worse? Or if a child with autism suddenly starts having aggression, do they have PANDAS, or is there something in their life that suddenly has exceeded their ability to cope in the normal ways that they cope, especially in the few years right before puberty, right at the cusp of puberty? There can be a lot of reasons maybe for extreme behaviors to appear, and that can make it difficult to recognize PANDAS or even to think of PANDAS. If your child has autism and they've had some struggles before, then suddenly they have a really, really extreme symptoms. You may just assume it's from the autism. And so the comorbidities can make it pretty tricky as well. And lastly, I'm going to say this one, but parents, don't get mad at me for saying this. Parents can also, via Dr. Google, be convinced their child has PANDAS when they do not have PANDAS. And they can come in really strong to the doctor, demanding, and, well, maybe not necessarily meaning to come across as demanding, but they may come in and say, I know exactly what's wrong with my kid. He has PANDAS. You need to test it. You need to diagnose it for PANDAS. And that will immediately trigger sort of the defensive wall from the doctor to say, like, what? You don't tell me how to do my job. So sometimes parents can unknowingly kind of be making it more difficult for the doctor to take them seriously by coming on like super strong about it. And also parents can want the diagnosis to be PANDAS in a way because it's a clear explanation for something. It's very much cause and effect. And I don't want to say that it's an easy answer, but it would be in some cases kind of a satisfying answer to have and think, okay, my child's suffering in this way, and PANDAS really explains that. That would explain it. And look, there's clear treatments we could do, and it could fix them or fix the issues that they're having. So there can be, I think, a temptation to kind of latch on to a diagnosis like PANDAS because, it's explaining these symptoms that may otherwise be scary and unsure how to fix, or maybe you might think could be lifelong. And so if a child suddenly is exhibiting like a panic disorder, sometimes parents can really be searching for a medical infection reason as sort of a pattern that they would like it to have a clear reason, when sometimes there isn't as clear of a reason. Interestingly, however, like a lot of research now is showing that certain psychiatric conditions like depression, even schizophrenia, may have an underlying inflammatory process or autoinflammatory process underlying them. So I think it's an interesting kind of frontier of research to think like, are more psychiatric and emotional disorders actually have an underlying inflammatory component? It's entirely possible. It's an interesting area being researched right now. So I would say to parents, my advice would be like, if you're going to go to a doctor and asking them about, could it be PANDAS, to approach it with an open mind and not sort of being too attached to the diagnosis, but sort of go with an open mind. Ask the doctor as a partner, like, what's your opinion? What could it be? Have you heard of PANDAS? I read about this. It sounds like maybe it could be, opening it like that and maybe asking like, oh, like, what about the strep titers? Like, could we do that? That's going to probably be more successful than barging in there and saying like, my kid has PANDAS. I know it. You need to find like blah, blah, blah. Just my advice there. Coming up. So in the next episode, I will talk about the standard of care for PANDAS, which I briefly touched on a few aspects. However, I will go into some more detail of what the normal procedures are. And again, this is not me telling you how to treat your child, rather informing you of the standard of care so you'll be more equipped to talk to your child's medical professionals and suggest and come up with a plan with them. In part 3, I will go into some alternative and holistic approaches to PANDAS and prevention once, once your flares has remitted, like some things that people suggest doing. And of course, these are things to bring to your medical provider, not to be going out on your own and doing. And part 4, some additional resources for PANDAS, Facebook groups, organizations, websites, foundations. I hope that was useful and informative to you. Again, my name is Francie Claire, and if you would like to know when the next issue is ready, you can subscribe and turn on the notification bell to be informed.